Ever think about like all the stuff going on inside us? I mean, the microscopic stuff, especially when it comes to our, urinary and reproductive systems.
Yeah, those systems are kind of crucial, right? But most of us just take them for granted, but there's a whole invisible world happening in there.
It's a world full of, tiny organisms and complex interactions.
Hmm.
And thankfully, we have some seriously fascinating material here to guide us through it.
Totally. The stuff you've gathered covers like everything. The nuts and bolts of these systems, the usual microbial suspects that hang out there, and then all the different ways things can go wrong, like bacterial and viral infections, even the ones that are, well, sexually transmitted.
And for this deep dive, our mission is to distill all that information, make it super clear for everyone listening. We want you to get a solid understanding of how these systems work, the microbes that play a role, and what happens when things get out of whack. But don't worry, we'll keep it engaging. No super technical jargon overload, I promise.
Right. We want to keep it interesting and easy to understand.
Okay, so let's start with the urinary system, the body's waste disposal system.
Think of it like your body's super efficient filtration plant. It all starts with those two bean-shaped organs, the kidneys. They're constantly filtering your blood, removing waste products and excess fluids, and that's how urine is created. Then the urine travels down these tubes called ureters to the bladder, which is like a holding tank.
Right, and from the bladder, it's eventually released through the urethra. And if I remember correctly, the kidneys themselves are pretty complex organs with different parts and regions.
Absolutely. You've got the renal capsule, which is that outer protective layer, and then the cortex, which is the outer part of the kidney where a lot of the filtration action happens. And then there's the medulla, this inner region. It looks kind of like a bunch of little triangles called renal pyramids, and all those structures work together to filter the blood and make urine.
So it's like a city inside each kidney, right?
Right.
And then within those pyramids are millions of these microscopic filtering units called nephrons.
Exactly. Each nephron is like its own little filtration factory. It all begins with this little bundle of capillaries called the glomerulus. And the glomerulus is nestled inside this cup-like structure called Bowman's capsule, or the glomerular capsule. That's where the initial filtration takes place. Then the filtered fluid, it flows through these winding tubes, the proximal convoluted tubule, the loop of Henle, and then the distal convoluted tubule. And from there, it goes into the collecting duct. And all along that journey, the nephron is fine-tuning the composition of the urine, reabsorbing essential substances back into the bloodstream, and getting rid of waste products.
It's amazing how it can do all that at such a tiny scale. Now let's switch gears to the reproductive systems. Our sources really emphasize the differences between the male and female reproductive systems, right?
Right, and those differences are important for understanding how these systems function and also for understanding how infections can occur.
So let's talk about the female reproductive system first.
So the female system is designed for, producing eggs, allowing for fertilization, and then supporting the development of a fetus. It includes the ovaries, which release eggs, the fallopian tubes or uterine tubes, which act as passageways for the egg to travel to the uterus, and the uterus itself, which is where a fertilized egg can implant and grow. And then there's the cervix, which is the lower part of the uterus that connects to the vagina. And the vagina is the canal that leads from the outside of the body to the cervix and uterus. It's important to note that the opening of the vagina is a potential entry point for microorganisms.
Yeah, especially during sexual activity.
Exactly. Now, the male system, it's got its own unique features and functions.
I'm assuming the male system is all about producing and delivering sperm.
Yep, you got it. So the male system includes the testes, which are housed in the scrotum. And then there's the epididymis, where sperm mature and are stored. And then we have the vas deferens, which carries the sperm from the epididymis to the urethra. Along the way, there are accessory glands, like the prostate gland, that contribute fluids to the semen. And the penis, of course, is involved in both urination and sexual intercourse. And in males, the urethra actually serves a dual purpose. It's the pathway for both urine and semen to exit the body. And so both the opening of the urethra and the skin of the penis are potential entry points for microbes.
Okay, so we've talked about the structures of these systems, and we should probably touch on the microbiome, that collection of microorganisms that lives on and in our bodies. Our sources point out that the urinary tract is generally pretty sterile, right?
Yeah, the urinary tract from the kidneys down to the bladder is typically considered to be sterile. Urine itself is acidic, and that helps to inhibit the growth of bacteria.
Hmm.
And the constant flushing action of urine also helps to keep things clean. but there are some microbes that can be found in the urethra.
So the urethra is not completely devoid of microbial life.
No, the urethra does have a small population of resident bacteria. These are typically non-harmful types, such as Lactobacillus, Staphylococcus, and Streptococcus. They're just kind of hanging out there, not causing any problems.
And what about the reproductive systems? What's the situation with the microbiome there?
The vagina has a very dynamic and complex microbiome. The composition of the vaginal microbiome can fluctuate depending on things like estrogen levels, menstrual cycle, and even sexual activity. But the key thing is that the normal, healthy vaginal microbiome is dominated by lactobacillus species.
And those lactobacillus species are beneficial, right?
Yes, absolutely. They play a crucial role in protecting the vagina from infection. They produce lactic acid, which creates an acidic environment, and that acidic pH helps to inhibit the growth of harmful bacteria and other pathogens.
So it's like a natural defense mechanism.
Exactly. But if that balance is disrupted, if the levels of lactobacillus drop, or if there's an overgrowth of other types of bacteria or yeasts, that's when infections can occur.
Which brings us to bacterial infections of the urinary system. I think most people have either experienced a UTI themselves or know someone who has.
Yeah, UTIs, or urinary tract infections, are super common, especially among women.
Why are women more prone to UTIs?
Well, it comes down to anatomy. Women have a shorter urethra than men, and it's located closer to the anus. So that makes it easier for bacteria from the gut, like E. coli, to travel up the urethra and into the bladder.
And those infections can be pretty unpleasant, right? Lots of discomfort.
Oh, definitely. Classic symptoms of a UTI include that frequent, urgent need to pee, even if there's only a small amount of urine. And it can burn when you pee. That's called dysuria. Sometimes the urine looks cloudy, or it even has a bit of blood in it, and it can have a strong, foul odor.
I definitely wouldn't want to experience that. But not all UTIs cause those noticeable symptoms, do they?
You're right. Some UTIs, particularly in older adults, can be asymptomatic, meaning there are no noticeable symptoms. And that can be tricky because the infection can still be present and potentially causing damage even if the person doesn't feel it.
So what are the most common bacterial culprits behind these UTIs?
As I mentioned earlier, E. coli, which is short for Escherichia coli, is the most frequent offender. It's a bacterium that normally lives in the intestines. But if it gets into the urinary tract, it can cause a lot of trouble. Other common culprits include Proteus and Klebsiella species, which are also gram-negative bacteria.
And these bacteria, they have special features that make them good at causing UTIs, don't they?
Yeah, they have certain virulence factors. Like, for example, E. coli often has these hair-like appendages called fimbriae that allow it to attach to the cells lining the urinary tract. And it also has flagella, which are whip-like structures that help it to move around and ascend the urethra.
So if someone has a UTI, what's the typical treatment?
Usually, antibiotics are the go-to treatment for UTIs. The specific antibiotic prescribed might depend on the type of bacteria causing the infection and the person's medical history. But common choices include cephalosporins, sulfonamides, and certain types of penicillins.
And if a UTI is left untreated, can it lead to more serious complications?
Yeah, if a UTI isn't treated, the infection can spread upward from the bladder to the kidneys, causing a kidney infection, which is called pyelonephritis. And in severe cases, the bacteria can even enter the bloodstream, leading to a condition called bacteremia, which can be life-threatening. So early diagnosis and treatment are really important.
That makes sense. So what can people do to prevent UTIs in the first place?
Well, simple hygiene practices can go a long way. For women, wiping from front to back after using the bathroom is really important. That helps to prevent bacteria from the anal area from getting into the urethra. Staying well hydrated is also helpful because it encourages frequent urination, which helps to flush out bacteria. And for some women, cranberry products might be beneficial. Cranberries contain certain compounds that can help to prevent bacteria from adhering to the walls of the urinary tract.
Now, we mentioned earlier that our sources don't go into much detail about non-venereal diseases of the reproductive system. So maybe we can just acknowledge that those exist and move on to a topic that is covered more thoroughly in our materials, STIs and STDs.
Yeah, STIs are a major global health concern. I think it's important to distinguish between the terms STI and STD. An STI refers to the initial infection with a sexually transmitted pathogen. An STD, on the other hand, refers to the disease or the health problems that can develop as a result of that infection.
So an STD is like the consequence of an untreated or unresolved STI, right?
Exactly. And STDs are incredibly widespread. According to the World Health Organization, there are hundreds of millions of new cases of STDs globally every year. And a significant percentage of those cases go unreported or undiagnosed.
Our sources highlight that young people are particularly vulnerable to STIs, right?
Yep, people under the age of 25 account for about half of all new STD cases. And teenage girls and young women are especially at risk for several reasons. The lining of the cervix in young women is more susceptible to infection, and STDs in young women are often asymptomatic, meaning they don't cause any noticeable symptoms.
So they might not even know they're infected, and that can lead to serious complications down the road, right?
Definitely. Untreated STIs can lead to pelvic inflammatory disease, or PID, which can cause chronic pelvic pain and infertility. Some STIs can also increase the risk of certain types of cancers, like cervical cancer.
That's pretty scary. So prevention is obviously key when it comes to STIs.
Absolutely. The most reliable ways to prevent STIs are abstinence, meaning refraining from sexual activity or being in a mutually monogamous relationship with a partner who has been tested and is known to be uninfected.
But for people who are sexually active, what are the most effective ways to reduce the risk of STIs?
Well, consistent and correct use of condoms during every sexual encounter is really important. Condoms can significantly reduce the risk of transmission for many STIs, although they don't provide 100% protection. Male circumcision has also been shown to reduce the risk of acquiring certain STIs, including HIV.
Let's talk about some specific STDs, starting with bacterial STDs. Our sources dive into gonorrhea, a really common and often talked about bacterial STD.
Gonorrhea has been around for centuries. It's caused by a bacterium called Neisseria gonorrhoeae, and it can infect the mucous membranes of the reproductive tract, the urinary tract, the rectum, the throat, and even the eyes.
I remember learning that it can be transmitted to a baby during childbirth.
That's right. If a pregnant woman has gonorrhea, the bacteria can be transmitted to the baby during vaginal delivery, causing an eye infection called ophthalmia neonatorum, which can lead to blindness if it's not treated promptly.
That's a pretty serious consequence. And I understand that gonorrhea can present differently in men and women.
Yeah, in men, gonorrhea often causes pretty noticeable symptoms. They might experience painful urination, a burning sensation, and a discharge from the penis, which can be thick and yellowish or greenish.
But in women, it's often a silent infection, isn't it?
Exactly. Many women with gonorrhea don't have any noticeable symptoms, or their symptoms are very mild and easily mistaken for something else, like a bladder infection or a yeast infection.
So it's possible for a woman to have gonorrhea and not even know it.
Absolutely, and that's one of the reasons why regular STI screenings are so important, especially for women who are sexually active, because even if a woman doesn't have symptoms, the infection can still be present and causing damage, potentially leading to pelvic inflammatory disease or infertility.
That's a really important point. And this bacterium, Neisseria gonorrhoeae, it's gotten pretty good at evading our attempts to treat it, hasn't it?
You're talking about antibiotic resistance, right?
Yes.
Yeah, unfortunately, antibiotic resistance is a big concern when it comes to gonorrhea. Over the years, Neisseria gonorrhoeae has developed resistance to many of the antibiotics that were once effective in treating it.
So what are the current treatment recommendations for gonorrhea?
The current recommended treatment for gonorrhea is a combination of two antibiotics, ceftriaxone, which is given as an injection, and azithromycin, which is taken orally.
But even with these newer antibiotics, there's still a risk of treatment failure, right?
Yeah, there have been cases of gonorrhea that are resistant to both of those antibiotics. So it's important to monitor for treatment failure. And if the infection doesn't clear up, alternative treatment options may need to be considered.
And is there a vaccine for gonorrhea?
No, currently there is no vaccine available to prevent gonorrhea. So prevention really comes down to those behavioral strategies we talked about earlier: abstinence, mutual monogamy, or consistent and correct condom use. And of course, regular STI screenings are crucial for early detection and treatment.
Now let's move on to viral STDs.
Right.
And the one we'll focus on here is genital herpes, which is incredibly common.
Yeah, genital herpes is a very prevalent viral STI. It's caused by the herpes simplex virus, or HSV. There are two types, HSV1 and HSV2. HSV1 is the type that usually causes oral herpes, those cold sores or fever blisters around the mouth.
But HSV1 can also cause genital herpes, right?
Exactly. HSV1 can be transmitted to the genitals through oral sex, but most cases of genital herpes are actually caused by HSV2.
And herpes is a lifelong infection, isn't it?
Yep. Once you're infected with HSV, the virus stays in your body for life. It goes into a dormant state in the nerve cells, and it can reactivate periodically, causing outbreaks of sores.
And what are the symptoms of a genital herpes outbreak?
Well, the classic symptom is the appearance of blisters or sores on the genitals, around the anus, or on the buttocks. These sores can be painful, itchy, or tingly. Some people also experience flu-like symptoms during an outbreak, like fever, body aches, and swollen lymph nodes.
And can genital herpes be transmitted even when there aren't any visible sores?
Yeah, that's one of the tricky things about herpes. Viral shedding, meaning the release of infectious virus particles, can occur even when there are no visible symptoms. So it is possible to transmit the virus even if you don't have any sores.
So how is genital herpes diagnosed?
If someone has the characteristic sores, a doctor can often make a visual diagnosis, but sometimes lab tests are needed to confirm the diagnosis. There are a couple of different types of tests that can be done. One is a viral culture, where a sample is taken from a sore and tested to see if the virus grows. Another type of test is a PCR test, which looks for the genetic material of the virus in a sample.
And is there a cure for genital herpes?
Unfortunately, no, there's no cure for herpes, but there are antiviral medications that can help to manage the symptoms and reduce the frequency of outbreaks. These medications can also help to reduce the risk of transmission to partners.
So are there any other ways to prevent the spread of genital herpes besides the usual abstinence, mutual monogamy, and condom use?
If someone knows they have genital herpes, it's important to avoid sexual contact during an outbreak when sores are present. And even when there are no sores, using condoms can help to reduce the risk of transmission, although it's not foolproof. There's also something called suppressive therapy, where people with herpes take antiviral medication every day to reduce the frequency and severity of outbreaks and to lower the risk of transmission.
So we've covered a lot of ground in this deep dive. We've learned about the fascinating and complex world of the urinary and reproductive systems, the microbes that inhabit those systems, and the infections that can arise when things get out of balance.
It's been a really informative discussion. Just to recap some of the key takeaways, we talked about the detailed anatomy of these systems, the role of the microbiome in maintaining health, the common causes and symptoms of bacterial UTIs, the global impact of STIs, and the challenges of preventing and treating STDs like gonorrhea and genital herpes.
And it's clear that having a good understanding of these systems and the potential risks is crucial for our overall health and well-being.
Absolutely. Being informed allows individuals to make responsible decisions about their sexual health and to seek appropriate medical care when necessary.
So for our final thought today, we want to leave you with a question to ponder. With microbes constantly evolving and antibiotic resistance on the rise, what do you think is the most effective way to safeguard our health in the face of these challenges? Is it primarily about individual responsibility, or do we need a greater emphasis on public health initiatives? It's a complex issue with no easy answers, but it's a conversation worth having. We encourage you to continue learning about topics like antibiotic resistance, vaccine development, and the importance of open and honest communication about sexual health. Thanks for joining us for this deep dive.
Yeah, thanks for listening, everybody.